In health news, a South Florida hospital is leading the way with a new type of surgery to give the severely obese a second chance at life.
CBS 4 health specialist Dr. Deanna Lights is here with more on this remarkable procedure. Doctor.
Well, you may have heard of people who are severely obese having a surgical procedure called a gastric bypass operation. It'll reduce the size of the stomach. Now there's a new approach to this procedure, and it's helping people win the war on fat. With the help of a walker, Joyce Blavitt is doing something she hasn't done in years: walk.
I no longer live in a hospital bed.
At more than 500 pounds, Joyce wasn't able to do much, and carrying the extra weight was a serious health risk. But 8 weeks ago, Joyce did something about it. She had gastric bypass surgery.
That we make a new stomach of the size of my thumb. This is a small stomach with approximately the capacity of about 1 ounce.
Doctors used a new technique called laparoscopic gastric bypass surgery. A number of tiny incisions are made in the stomach area, rather than one large incision down the middle of the stomach. Then, using special instruments, a camera and TV monitor, doctors create a new small stomach pouch. Doctors say the laparoscopic method has lots of advantages over traditional bypass surgery, like less pain, shorter hospital stay, and faster recovery. It's been 8 weeks since Joyce had her surgery. She's lost over 90 pounds, but gained a new lease on life.
And one day I said to my husband, I'm going to try to walk. And I walked. And now it's 8 weeks later. I don't have a bedside commode anymore. I go to the bathroom like a normal person.
Now again, bypass surgery is a last resort. It's for very obese patients, those who are at least 100 pounds or more over their ideal weight. And not all insurance companies will pay for the surgery, so you want to check. Otherwise, it'll run about $5,000. Dr. Deanna Lights, CBS 4 News.
And going under the knife to lose weight. We're talking to one South Florida patient who made history doing just that. Her story next.
A South Florida woman making history by going under the knife for a controversial weight loss surgery.
The woman losing close to 100 pounds in just weeks because of that operation. Tonight, she's talking to 7's Alicia Lane.
And I got up. And I stood on the walker and I walked from my bed into my kitchen for the first time, and I cooked eggs. And now I'm cooking in the kitchen and I'm able to do all those things, and it's a miracle.
A miracle Joyce Blavitt says she owes to modern science. The 53-year-old bedridden for 3 years, her life limited by obesity, her weight topping 524 pounds. Until 7 weeks ago, when she underwent a surgery called gastric bypass.
Since then, I've lost 94 pounds. I've lost 20.5 inches on my body. I'm walking for the first time in 3 years.
The procedure involves a sort of splitting of the stomach, creating a new, much smaller stomach, which results in a smaller appetite.
Limited the amount of food that you can put inside the unit. Control the intake of the food.
You get full faster.
That's correct. You get full faster.
Dr. Carlos Carrasquilla of the Florida Medical Center is one of the few here in South Florida who performs the surgery, making only small incisions rather than one large cut. The procedure saving patients the scars, both physically and mentally.
You see this young lady here?
Looking at these before and after photos, you'd never recognize these people.
Do the spin around.
In the flesh, they look even better.
I've lost 121 pounds, and I feel fabulous.
The people who've had the surgery tell us when you're wearing a pair of pants this size, it's not only the pounds that weigh you down, you're also affected psychologically, emotionally, medically, and economically.
There's nothing you can really do. You try diet after diet after diet after diet, and you lose 10, 15 pounds, but then you gain 30.
After the surgery, Esty Gonzalez went from a size 22 to a size 1. Doctors say because obesity proves a health risk, insurance companies will often cover the cost. But as with any surgery, there are risks, including long-term health problems like bone loss, anemia, plus vitamin and mineral deficiencies. And because the results prove dramatic, some lose more weight than they'd like, and reversing the procedure is even riskier. For many, the pros outweigh the cons. The hope of one day being thin is worth the risk. In Oakland Park, Alicia Lane, 7 News.
Well, in order to qualify for that procedure, you have to be at least 100 pounds overweight. Each case is treated differently also. Doctors warn it is a decision which should not be taken lightly in any case.
In other words, it's not for everyone out there. Still ahead.
And a woman battling obesity finally loses 100 pounds. You'll see how an operation may have saved her life. Next on Eyewitness News.
Obesity is considered an American epidemic. Billions of dollars are spent each year to lose weight.
Yeah, tonight, surgeons have hope for some overweight people, the operation that can restore health and self-confidence in patients. Eyewitness News reporter Vicki Fraser-Williams shows us the amazing before and after.
I can't believe it's me. Marcy Borger still shakes her head in disbelief over her drop in weight from 279 pounds to 163 pounds.
It's a size enormous, size jumbo.
She can practically wrap herself up in the clothes she used to wear, an experience every patient in this room can brag to after a new kind of weight reduction surgery that's changing their lives.
I never really had a weight problem until I was in my early 20s, and I started to gain and started to lose here and there. About 14 years ago, I had lost 125 pounds. It took me 2.5 years of quack diets and quack doctors and drugs, and in 8 months I gained it all back, and it was devastating.
I had to order my clothes by mail and hoping that they would fit, and you paid more money for that. That was one of the drawbacks.
And this is walking after 2 years of being on bed, 3 years of being on bed and wheelchair.
It's a triumph worth celebrating for Joyce Blavitt and her doctor, who is making weight reduction history at Florida Medical Center.
Obesity is a very complex disease.
Dr. Karaskija is the first to perform laparoscopic gastric bypass using a thin telescopic lens connected to a camera to guide him as he reduces the stomach with small punctures instead of large incisions.
Less pain, decrease the chances of some of the complications. It's less time in the hospital.
At 524 pounds, Blavitt was the largest person ever to undergo the surgery. Her weight, a critical health concern.
I no longer live in a hospital bed. Next month, I'm supposed to be dead. I was given 3 months to live.
S.D. Gonzalez had the surgery without the laparoscopy.
So the recovery was a little bit longer and a little bit more painful than the other new people have been doing it. But it was something that I'm well worth. I'd do it again. I'd do it again in a heartbeat.
Because now she can do things she never dreamed of before. In Lauderdale Lakes, Vicki Fraser-Williams, Channel 10 Eyewitness News.